Whew. Okay. Quick vlog update. Today, is my bandage on this side too? Oh, she just put a little tight strip adhesive on there to keep it down. I haven't been using the person seal wrap correctly. We haven't, but I've been doing the best I can. I don't like the dry blood and stuff in the port, so but they have it set to change the bandage on specific days to reduce the risk of infection. I definitely respect that. Today's appointment and my last appointments have just been for labs. Tomorrow is a long day, like a half of a day's worth of appointments. For me to begin chemo treatment. Chemo is high, fast, and hard. Um, so I'm a little intimidated because this nerve pain has been not letting me sleep, not letting me get proper rest, not letting me um, increase my appetite, not letting me function as I should be able to function. So I'm either hoping chemo side effects begin so immediately that they override the nerve pain, or because the chemo has steroids and the steroids use is what causes the breakdown that causes the nerve pain, that somehow it interrupts the nerve pain. This chemotherapy is different. It is the stem cell transplant chemotherapy. It's the older chemotherapies with alopecia as one of the side effects. So I am not anxious. If I lose my hair, I lose my hair. I'm more curious about losing my eyebrows and my body hair. I have everything that's recommended on the list to get as far as the soaps and ointments, throughout way all makeup. Um Got my organic castor oil. I have my teas. I have my massager. I have all of my um got my sponges, my specific um body wash, bath wash. I'm even started the parts of packing my overnight bag for the hospital stay. The transfusion, which is when I receive my stem cells back, is considered day zero. All of these days before have been minus days. The transfusion day will be day zero. I'll find out tomorrow what day that will be, either uh Friday or Thursday or Friday. Um and which night I'll check in. Um or which morning I'll check in to the hospital for the overnight stay. I do get my bandage changed. It's scheduled for the 20th on Thursday, so maybe it's inpatient, but either way, all my numbers are normal. My levels are, everything is where it should be. I was able to do the stem cell collection in one day. Last Thursday, the apheresis. And God is good. I'm still waiting on the answer and the resource of disability, SSI. I did get caregiver approval, so Brian and Colin are approved as caregivers and able to clock in, and we got registered and we did all of those things. Um, Received rent assistance from United Way. Received another grant from Cancer Warriors, and another grant from the Ikla da Silva Foundation. The other two were smaller grants. United Way was the largest. Um, so that so that I can make sure that we have housing and things we need for the 100 days of the stem cell transplant. I got family and friends checking in. Every time somebody sees me or says, "Hey, well, you look good," I am grateful. And even when I look different, not saying that I don't look good, even when I look different, I'm still grateful. So, um, some days it's hard to record, some days it's hard to vlog, some days it's hard to update because I really do not, it's very hard for me to record myself in pain and in tears. And I spent Friday and part of, well, Friday was manageable, but I spent so much of Saturday and Sunday in tears, just crying out from the pain because I just don't know what to. Well, partially because I'm emotionally and mentally, spiritually, and physically exhausted from just having maybe 30-minute naps, 45-minute naps, hour naps throughout the course of the night. It's still hard for me to sleep in the daytime, but throughout the course of the night, instead of sleeping, I don't know how or if I'm getting REM sleep because I can remember being up at 1 something and then 3 something and then 4 something, 5, 6, like I can count. So I don't know how this disrupted sleep uh calculates REM sleep, but I do know that it can't be healthy. It cannot be good for my health. But I am letting my doctors know. I'm putting everything on the chart on the pain scale. I will see the doctor tomorrow, right before the chemo treatment, and they did change the prescription, double my prescription, but that for the Cymbalta duloxetine, but it's not an immediate relief. There is no immediate relief for nerve pain. So it doesn't, like people say, don't you have something for the pain? Not this pain. Um, it Tylenol, nothing reaches it. No, pain relievers don't reach it. So and the Cymbalta is actually a medicine prescribed. I think I said this in an earlier video. It's actually prescribed use, but one of the things that it also does is address nerve pain and start to get some of those nerve receptors to start recovering from the side effect of the steroids, for the chemosteroids. So, but that's a process for it to bring relief. And the pain is so indescribable. Most of the time, like right now, I can feel the pain, but it is, and so it's persistent, but it wouldn't, if I was able to fall asleep, it wouldn't wake me up out of my sleep. For some reason, I don't know if it's because I'm trying to still exercise and stretch and move and try to intervene with the pain by distracting myself, like what I'm doing right now, try to flex my toes, or I'm one of those people like you got a hangnail, you just try to squeeze all the pain out. So or squeeze as much of the pain out so that you can then release it and kind of get into that space of release and keep that momentum. So that's what I've been doing. I don't know if that's the wrong thing, because even when I don't do that or try the alternative or try to wrap them up or try heat or cold or some other intervention, heat or ice, or I've tried everything and it's really no relief. Somebody suggested pain quill, because like Z-Quil to help you sleep, but I don't have a problem falling asleep. Like I still go to bed at bedtime. I just don't stay asleep because then the pain is like wake you up, push you up, jerk you up, like shooting. It is like somebody poking glass across your feet and toes, top and bottom at the same time, like that is the pain. You can't sleep through it. And anybody who tells you that they can sleep through it, that's not this pain. This is not what that is. But I believe in the power of prayers. The prayers of the righteous availeth much. This kind goeth out by prayer and fasting. I have people praying for me. I have people fasting for me. I'm grateful. Um, I'm just hoping that the chemo, high, fast, and hard are above the pain or get me above the pain. Um, yeah, or the medication or doubling the medication starts having some relief, which I expect to. They said it takes more than a week, but I'm expecting the favor of God to give me grace for it to take effect within a week. All my other medications are fine. Still not able to gain any weight. The expectations that I will lose 15 to 20 pounds through chemo, I don't really have 15 to 20 pounds to lose. 15 more pounds and I'll be like 145. And that does not seem like, I don't think 50-year-old people should be 150. So I don't think that doesn't seem like a healthy weight to me. So, but we'll see. I'm doing the best I can for appetite and nutrition. Have a meeting with the dietitian, I think tomorrow also. Um, so yeah, trying to apply every remedy, intervention. I'm trying to go through this as smooth and easy as is possible with every expectation of healed, sealed, cured. Thank you for the love. It lifts me. If I don't answer the phone, it's because I really don't want you to be concerned for me by hearing me cry in pain when I can't do anything other than cry out to let it out. Um, and this has never been me, so I've never been here before. Being needy, I feel needy and weepy, and I don't like it. But I am faithful, full of faith, and grateful, full of gratitude, gratefulness. So we'll see who I am gonna be. Be encouraged.